Welcome to the Health Headliner podcast by Tudu Digital. Our content is informational only and not medical advice. Please consult your provider. Now, let's dive into today's headlines.
Okay, it is January 2026. But before we get started today, I want to ask you to do something. I want you to, just for a moment, reset your internal clock.
A little mental time travel.
Exactly. We don't have to go back very far. Just a few months to September 2025. Do you remember what the atmosphere was like then?
Oh, I remember it very well. It was a difficult time for the medical community and especially for patients.
Especially if you were an expecting parent or you knew anyone who was pregnant, the air was just thick with this very specific kind of anxiety.
It was palpable.
You couldn't scroll through a news feed. You couldn't turn on the TV without seeing a headline. And these reports, they were often citing U.S. government sources, and they were suggesting this terrifying link.
The narrative was that acetaminophen, which is, the world's most common painkiller.
Paracetamol, Tylenol, whatever you want to call it.
Right. That this incredibly common drug was causing autism and attention deficit hyperactivity disorder in children if you took it during pregnancy.
And you really have to stop and think about the weight of that fear. I mean, can you imagine?
It's an enormous burden. You're told that the one thing, the standard of care medicine that you've been using, that your doctor recommended.
The thing you thought was safe.
Exactly. That thing might be fundamentally altering your child's brain development. It's terrifying.
It is. But the reason we're here today doing this deep dive on January 17th, 2026 is because the ground has completely shifted under our feet again.
But in the other direction this time.
Yes. This time, it hasn't shifted toward more panic. It's shifted toward clarity.
It's one of those rare, almost beautiful moments in scientific research. The pendulum is swinging back, but it's not based on, opinion or a hunch. It's based on vastly superior data.
So what happened?
Well, just yesterday, January 16th, a massive new study was published.
In the Lancet Obstetrics, Gynecology, and Women's Health.
That's the one. And it completely, and I mean completely, flips the script on what we all thought we knew just 4 months ago.
And this isn't just another small survey or, a collection of anecdotes. People are calling this the most rigorous analysis of the evidence to date.
And for good reason. It's a systematic review and a meta-analysis. It was led by a team at City St. George's, University of London, and their whole mission was to look at only the highest quality evidence.
They wanted to see if those scary headlines from September actually held any water.
And spoiler alert for anyone who's still feeling a bit tense.
They don't.
They do not. The study debunks the link. But our goal for this deep dive isn't just to give you that headline and, sign off. We really want to understand how they debunked it.
Right, the process.
Yes, because the method they use, it's something called sibling comparisons, and it's essentially a masterclass in how you separate true cause and effect from just a coincidence.
That's the key, isn't it? And that's what we're going to explain, why these sibling comparisons are the secret weapon in this kind of research.
And we'll also talk about why, and this is maybe a bit counterintuitive, but why suffering through a fever without any medication might actually be the more dangerous choice for a pregnancy.
Okay, so let's get into it. To really appreciate the relief we're feeling in January 2026, we have to go back and understand the trap we were all in. Let's start with just how common this drug is. Acetaminophen isn't just an option for pregnant people, is it?
No, for many, it's really the only option. When you look at the landscape of what's available for pain and fever in pregnancy, it's pretty barren. Acetaminophen is the first-line defense.
And why is that? I mean, why not just take an ibuprofen or an aspirin?
It all comes down to the safety profiles for the fetus. Doctors generally advise against what we call non-steroidal anti-inflammatory drugs, or NSAIDs.
So things like ibuprofen.
Right, especially later in the pregnancy, because there are potential complications with the baby's heart and kidneys.
Okay.
And then on the other side of the spectrum, you have opioids, which of course carry really severe risks of dependency, withdrawal for the baby, and other terrible outcomes.
So acetaminophen has always just sat right in the middle. It's been the safe harbor for decades.
It has, and that's exactly why the controversy back in September 2025 was so destabilizing. It wasn't just that some drug might be bad, it was that the safety net might be bad.
The one thing everyone relied on.
Precisely. And, to be fair to the scientific process, the concerns that were raised back in September, They weren't just fabricated out of thin air.
That's an important point.
It is. Previous studies did show statistical associations. They looked at huge groups of women, and they found that those who reported taking acetaminophen were, statistically, more likely to have children with neurodevelopmental issues.
Which brings us to the critical question. I think this is what a lot of you listening might be asking right now. If the old studies showed a link, and this new study says those old studies were just wrong, how do we trust this new one? What was the flaw in the old data?
The flaw, in a word, is confounding. It's all about confounding factors.
Okay, let's unpack that term. What exactly is a confounding factor?
So, in epidemiology, a confounder is basically an unmeasured third variable that kind of gets in the middle and distorts the relationship between the two things you're actually trying to study.
It muddies the water.
It muddies the water perfectly. So in those older studies, the researchers saw A, mothers taking the drug, was associated with B, children with higher rates of these conditions.
Okay.
But what they couldn't easily do was distinguish whether the drug itself caused the problem or if the reason the mother took the drug was the actual culprit.
Because you don't take a painkiller for fun.
Exactly. You're not taking it recreationally. You're taking it because you're unwell.
You have a fever or a horrible headache or some other underlying health issue.
Right. And we know for a fact that things like maternal fever or chronic inflammation or even severe stress, those things are, in themselves, risk factors for fetal development.
So in those old studies, they might have been blaming the pill for damage that was actually caused by the illness the pill was trying to treat.
That's a concept we call confounding by indication. But there's another layer to this, which is even harder to control for in standard studies.
Oh, what's that?
Genetics and the family environment.
Right, because the old studies were often comparing two totally different families.
Correct. You're comparing family A, where the mother took acetaminophen, to family B, where she didn't. But family A and family B have completely different genetic makeups.
Different socioeconomic statuses, different diets, different stress levels.
The list goes on and on. You're basically comparing apples to oranges and trying to draw a conclusion about the apple.
And that kind of comparison just creates all this statistical noise in the data.
It creates bias. That's the technical term. And that is exactly what the researchers at City St. George's, University of London, set out to eliminate. They wanted to strip away all of that noise.
Okay, so let's talk about the design of this new study, because the scale of it is, well, it's frankly staggering. This was not a small lab experiment.
No, not at all. This was a systematic review and a meta-analysis. And for anyone who isn't familiar with the hierarchy of scientific evidence, this kind of study sits right at the very top.
The highest level.
The highest level. They didn't just do new research. They reviewed 43 different existing studies. But, and this is the important part, they didn't just throw every study into a bucket and average out the results.
They were selective.
Very selective. They used a special tool called QIPS. That's QUIPS. It stands for Quality in Prognosis Studies.
What does that do?
It lets them rigorously grade each of those 43 studies for its risk of bias. They were specifically looking for the highest quality research methods. They were filtering out the noisy data to find the clear signal.
And the clearest signal came from this secret weapon that we mentioned earlier.
The sibling comparisons.
This is the part of the methodology that I find just so clever.
Yeah.
Can you break down for us how a sibling comparison actually works in this context?
It's just a brilliant, elegant way to control for all that genetic and environmental noise we were just talking about. So in a standard study, as we said, you compare different mothers. In a sibling comparison, you compare the same mother across her different pregnancies.
So you have one mother who has two children.
Exactly. Let's paint a picture. A mother has her first child. During that pregnancy, maybe it was a bad flu season, she ran a high fever for a few days, and she took acetaminophen to manage it.
Okay, so that child was exposed.
That child was exposed. Now, a few years later, she has her second child. During that pregnancy, she was perfectly healthy, never got sick, and took no medication at all.
Unexposed. Now you have a perfect control group right inside the same family.
You do. By comparing those two siblings, you automatically instantly control for a huge number of variables.
Shared genetics, for one.
Shared genetics, of course,
right,
but also the household environment, the socioeconomic status, the parents' education levels, their diet, their long-term health characteristics.
Because most of those things tend to stay the same between the birth of the first kid and the second kid.
Precisely. So if acetaminophen was a true neurotoxin, I mean, if the chemical itself was directly attacking the developing brain, what would you expect to see?
You'd expect the child who was exposed to the drug to have a much higher rate of autism or ADHD compared to their unexposed brother or sister.
You would, because you've isolated the drug as the primary variable that's different between the two pregnancies. It's a much, much cleaner way to look for a real effect.
It's the closest we can get to a randomized controlled trial in this situation, right? Because obviously you can't ethically experiment on pregnant women.
You can't. You can't tell one group to take a drug and another not to. So this is the next best thing. It's our best observational tool.
And the sample size they managed to get by combining all these high-quality studies, it allows for an incredible level of confidence. I'm looking at the numbers here, and they're just massive.
They're huge. For the autism assessment, they were able to look at the data for 262,852 children.
Over 250,000 children. Just for autism?
Just for autism. And then for attention deficit hyperactivity disorder, the number was even higher. It was 335,255 kids.
Wow. And for intellectual disability?
That's the largest group, 406,681.
When you're dealing with numbers that large and you're applying this really rigorous sibling comparison method, statistical flukes just, they tend to disappear, don't they?
They do. If there's a real true link there, it should shine through brightly. And if there isn't one, it should completely vanish into the noise.
So let's deliver the verdict.
Yeah.
They've got the huge numbers. They've got this brilliant sibling methodology. They've got their QIPS bias filter. What did the researchers at City St. George's actually find?
The findings were, they were stark. And they were incredibly consistent across the board.
Which was?
When you use the sibling comparisons, when you only look at the high-quality data, the link disappears.
Completely disappears, not just gets small.
Completely. For autism, no link found. For attention deficit hyperactivity disorder, no link found. And for intellectual disabilities, no link found. Gone.
That is about as definitive as it gets in medical research.
It really is. And they didn't stop there. They went a step further to make sure they weren't missing some kind of nuance.
What else did they look at?
Well, they looked specifically at studies with really long follow-up periods, studies that tracked children until they were older than 5 years old, just to make sure these conditions didn't just appear later in childhood.
And what happened?
The result held firm. Still no association. Then they did another analysis where they looked strictly at only the studies they had graded as having a low risk of bias, throwing out anything that was even a little bit questionable. Again, the result held firm. No link. Every time they sliced the data in a more rigorous way, the supposed effect just melted away.
This brings me to what I think is a really important rehook for our listeners here. Because if this new, massive, incredibly well-designed study proves the drug isn't hurting the baby, then what on earth was creating those scary statistics in the past? Why did we spend the better part of 20 years thinking there was a link here?
That is the pivotal question, isn't it? If the smoke wasn't coming from the gun, where was it coming from? And the answer brings us right back to those confounding factors we talked about earlier.
Specifically genetics and the reason for taking the drug in the first place.
Exactly. And we have some really good insight here from the lead author of the study herself, Professor Asma Khalil.
What does she say?
She put it very clearly. Her quote was, "Our findings suggest that previously reported links are likely to be explained by genetic predisposition or other maternal factors such as fever or underlying pain, rather than a direct effect of the acetaminophen itself."
Let's break that down again, because this is the concept that really exonerates the medicine. Confounding by indication.
Right. Just think about the why again. A mother takes acetaminophen because she has a fever. We know from lots of other research that fever itself can be dangerous during pregnancy.
Also,
a high body temperature can actually disrupt the way proteins fold and function during fetal development, especially in the brain. So what previous studies were seeing was a link between taking the pill and developmental issues.
But what they were actually seeing was the link between having a fever and developmental issues.
The pill was just a marker that the mother was sick. It was an innocent bystander that was, trying to put out the fire.
It was at the scene of the crime, but it wasn't the perpetrator.
A perfect analogy. And then you have the genetic component that Professor Khalil mentioned. Neurodevelopmental conditions like ADHD and autism have very strong genetic components. They are highly heritable.
So how did that mess up the data in the older studies?
Well, let's consider a scenario. A mother who has perhaps undiagnosed ADHD herself. We know that neurodivergent individuals sometimes experience pain processing differently. They might deal with higher levels of stress, more frequent headaches.
So a mother with those genetic traits might just be more likely to reach for a painkiller in the first place.
She might take the medication more often, yes, but she is also, just by biology, much more likely to pass her genetic traits for ADHD down to her child.
So in a traditional non-sibling study, the data point looks like mom took Tylenol and then the kid got ADHD.
Right, but what's really happening is mom has the genes associated with ADHD. She took Tylenol for her pain, and she passed those ADHD-associated genes to her kid. The Tylenol had nothing to do with it.
And the sibling study filters this out because both siblings are equally likely to inherit those genes from their mother.
Exactly. Once you control for that shared genetic inheritance, the statistical link to the drug just evaporates. It's gone.
That is such a crucial distinction to make. It really changes how you view all those headlines from last year. It's not just about what you take, it's about who you are and what's happening inside your body.
It's a fantastic lesson in the true complexity of biology. You can't just draw a straight line from A to B.
Okay, I want to pivot now. I want to talk about the so what of all of this, because this isn't just an academic exercise in statistics and methodology. There's a real-world danger here if people ignore this new data.
The danger is avoidance. This is the critical public health message that has to come out of this study.
Explain that. Why is avoiding this drug so dangerous?
Because the alternative to taking the recommended drug is often leaving a serious condition completely untreated. If pregnant people are scared of the medicine, they might just decide to tough it out and endure high fevers or severe pain without any treatment.
And as we've already touched on, a fever isn't just uncomfortable when you're pregnant. It's actually risky.
It's very risky. Untreated maternal fever has been linked to miscarriage. It's been linked to preterm birth. It's even been linked to certain congenital birth defects, like neural tube defects. The heat itself can be damaging.
And what about severe pain?
Severe, untreated pain causes a massive stress response in the body. It spikes your cortisol levels. It can affect your blood pressure. That kind of prolonged physiological stress is also incredibly detrimental to a healthy pregnancy.
So by avoiding the medicine out of a fear of autism, a fear that this brand new gold standard study says is unfounded, parents might be walking right into the very real, very well-documented risks of untreated illness.
That is the tragedy of medical misinformation. It doesn't just create anxiety, it drives people toward measurably more dangerous choices.
And Professor Khalil, the lead author, she really hammered this point home.
She did. She said, and this is another quote, "The message is clear. They should feel reassured that they still have a safe option."
It's also worth noting that the major medical organizations have been pretty consistent on this, even during the panic.
They have. Groups like the American College of Obstetricians and Gynecologists in the U.S. and the Royal College of Obstetricians and Gynecologists in the U.K., they have consistently endorsed acetaminophen as the first-line medication.
So this study is really just a massive validation of the guidance they've been giving all along. It's a huge clinical reassurance.
It is a very welcome one.
However, in the spirit of being thorough, and we always want to be thorough here on the deep dive, we should probably address the limitations. Even a study this big and this well-designed isn't magic. The authors themselves pointed out some gaps in the data.
They did, and it's good scientific practice to do so. It's important to be honest about what we still don't know.
So what was the primary limitation they noted?
The main issue was a lack of granular detail in the original data sets they were analyzing, specifically regarding the usage of the drug.
What do you mean by granular detail? Like how much they took?
Exactly. The when and the how much. Many of the underlying studies they included didn't have precise data on which trimester the drug was taken in, or the exact dosage, or the duration of use.
So they would know that the mother took it at some point during the pregnancy, but they wouldn't know if she took one pill one time in the first month or 2 pills every day for the entire third month.
Correct. And the reason is that there just weren't enough existing studies that recorded that level of detail consistently enough to allow for a deep sub-analysis of, say, dose response.
And I'm guessing self-reporting is an issue here too, as it almost always is in these types of retrospective studies.
Yes, of course. It's a phenomenon we call recall bias. If you ask a mother to remember, years later, exactly what medication she took during a pregnancy 6 or 7 years ago, her memory might be imperfect.
And that can skew the data.
It can. And interestingly, recall bias can actually skew the data toward finding a false positive, a false link.
How does that work?
Well, Mothers of children who have developmental issues often spend years searching their memories more aggressively, trying to find a cause. They're just more likely to remember and therefore report taking a painkiller than a mother of a neurotypical child who might just forget she ever took one.
That makes perfect sense. But the researchers argue that the sibling design helps mitigate this a bit too.
It does. Because the mother is the same person reporting for both children, the biases in her reporting tend to be consistent between the two pregnancies, which helps cancel out some of that error.
So even with those limitations, the authors still feel confident.
Yes. They argued that despite these gaps, the sheer consistency of the null result, the fact that the link disappeared every single time they applied the quality filters and the sibling design, is still very, very strong evidence.
So where does that leave us at the end of the day? We've traveled from the widespread panic of September 2025 all the way to this massive reassurance in January 2026.
I think it leaves us having moved from a place of fear to a place of evidence. The most rigorous evidence we have to date, using that gold standard sibling comparison method, shows no link between taking acetaminophen during pregnancy and these neurodevelopmental disorders.
The mission of this deep dive was really to separate the fact from the fear. And the fact, it seems, is that the boring advice was the right advice all along.
It's a perfect example of how science is supposed to work. It's self-correcting. And in this case, that correction is an enormous relief.
So here's the call to action then for anyone listening. If you are pregnant or if you know someone who is, and they are suffering from a fever or from severe pain, the message from this study and from the wider medical community is crystal clear.
Do not suffer in silence out of fear.
Right.
Consult your medical guidance, always. Talk to your doctor or your midwife. But you should understand that managing fever and managing pain is a vital part of a healthy pregnancy. You do not need to be afraid of the first-line treatment anymore.
I want to leave you with a final thought to mull over because I think this story tells us something bigger about science communication. We live in an attention economy, and that economy thrives on the scary discovery.
Absolutely. Fear gets clicks.
It does. The headline that says common drug causes harm will always travel faster and further than the headline that says common drug is actually fine, carry on.
That's just human nature, I think. We're wired to look for threats in our environment.
Exactly. But what we saw today is that sometimes the most important scientific breakthrough isn't the discovery of a new danger, but the definitive removal of an old one. Sometimes the most exciting thing that science can give us is just permission to breathe a little easier.
And permission to treat our pain without adding a layer of guilt on top of it.
Exactly that. Thank you so much for joining us on this deep dive. We really hope this clears the air and helps you navigate the noise. We'll see you next time.
Thanks for tuning in to the Health Headliner podcast by Digital. Like and subscribe for more health news and breakthroughs. Stay healthy and informed. See you next time.